Most children will be in a bad mood sometimes, but some kids experience severe symptoms that lead to big problems at home and school. This might be a sign they have a disruptive mood dysregulation disorder, or DMDD. DMDD is a condition when children have ongoing anger or intense temper outbursts. Superior wants to help parents and caregivers find ways to address these issues. Children with DMDD may have severe temper outbursts 3 or more times per week. These outbursts are more severe than what is expected for children at this age. Children with DMDD may be irritable or angry for most of the day, nearly every day. That includes even when they're not having an outburst. Children with DMDD also might have trouble functioning at home, school, or with peers due to this irritability. For example, a parent may tell their child to stop playing a game and do their homework. This could make any child frustrated, but a child with DMDD may become extremely upset and have an intense temper outburst with yelling and even hitting. Children who have DMDD are normally diagnosed between the ages of 6 and 10. To be diagnosed, a child must have symptoms for 12 or more months in a row, and this must cause issues in more than one setting, like at home, school, and with their peers. Parent and caregiver training should be the first step to addressing DMDD. These trainings teach ways to respond to irritable behavior. This includes anticipating events that might lead a child to have a temper outburst. Training also focuses on being consistent with children and rewarding positive behavior. It's important for caregivers to learn as much as they can about the disorder. They should also work with their child's doctor to make treatment decisions. Treatment for DMDD may include psychotherapy and medications. Treatment is often based on what's helpful for symptoms that can show up in other disorders. These include attention deficit hyperactivity disorder, ADHD, oppositional defiant disorder, ODD, and anxiety disorders. Cognitive behavioral therapy, CBT, is about the relationship between thoughts, behaviors, and feelings. It's often effective in treating anger and disruptive behavior. Dialectical behavior therapy for children, DBTC, teaches them skills that may help them regulate emotions and avoid extreme or prolonged outbursts. Even with therapy, parent and caregiver training is an important way to support these kinds of treatments. Currently, there are no approved medications for DMDD. To treat DMDD, healthcare providers may prescribe certain medications to address specific symptoms. Medications may include stimulants, antidepressants, and atypical antipsychotics. Stimulants are often used to treat ADHD. Research shows that stimulant medications also may decrease irritability in children. Antidepressants are sometimes used to treat irritability and mood problems that children with DMDD may experience. Certain atypical antipsychotic medications may be used to treat children with irritability, severe outbursts, or aggression. Superior can help members get access to care and community support services. Superior's Service Coordination Team can provide resources and help with finding services in your area. Superior also offers behavioral health services. These include outpatient mental health and substance abuse services, psychiatric hospital services for members 21 and under, detoxification, rehabilitation, and housing supports, medications for mental health and substance abuse care, and online behavioral health resources. Being a parent or caregiver for a child with DMDD can be overwhelming. But there are ways to get the support you need. These include talking to your child's teacher, counselor, or school psychologist. They can work with you to come up with a plan to help your child succeed in school and at home. Finding tips on how to prepare for a provider visit and how to communicate with your child's healthcare provider. Using existing resources while also finding healthy ways to manage your stress. If your child has coverage from Superior and you think they have DMDD, please call their service coordinator. You can also call the number on the back of their member ID card. Remember, you are not alone.